There are so many families here in Georgia that are struggling. A new study is really startling. 1 in 3 Georgia families experiencing a level of food insecurity. 1 in 5 report having very low food security, meaning they skip meals, feel hungry, go to bed without eating because of food costs. These are our neighbors, people we love and people who live close to us. It's a really important study that we want to bring in Stephen Patrick with Emory University to talk about. And, sir, what stood out to you with this study?
Well, it is striking how affected Georgians are, and particularly this was focused on Georgia parents with children in their home. And so, as you said, we found that 1/3 have some element of food insecurity, and still that's not evenly distributed across the state. What we see is that lower income families have higher rates of food insecurity. Those that make less than $75,000, for example, 44% report some level of food insecurity. We also see that rural families and black families are more affected in the state of Georgia.
1 in 3 families facing food insecurity seems so high and so startling to me. Can you talk about the seriousness of those numbers?
Yeah, well, it translates into kids and how kids can perform. So what we know about food insecurity is that if you're a food insecure kid, you have a harder time learning. You might be more distractible. And there's some evidence to suggest that being food insecure as a child may have long lasting effects. So I hope, just like your last segment, that this is a call to action for all of us, not just our state legislators, but also for each of one of us in every part of the community. Because, as you said, these are our neighbors and our kids who are affected.
Your data shows that rural families and black families are hit the hardest. Can you talk about that disparity and what your data shows about that?
So our poll is sampled to be representative of Georgia parents, and it enables us to, with this sample, to kind of dive into the different experiences that different people across Georgia have. And we do see a disproportionate effect of food insecurity. The other thing that we looked at were a couple of things like including SNAP. You mentioned SNAP in the last segment. Almost half of the folks that had SNAP uh, had some disruption in SNAP over the last year. So even when folks are getting assistance, they are struggling to keep it. We also asked about free and reduced lunch. About 14 parents revealed that they had some disruption in free and reduced lunch. So it's sort of impacting all throughout where kids are and where families are.
Yeah, what are the biggest barriers families face when they're trying to become food secure?
So food costs is really driving. So we ask parents, because of food costs, have you cut back on the way you spend? And what we found was about 60% said yes. About three quarters saying that they were eating at restaurants less frequently. Some changed what they eat, what they buy. So it's costs and it's being able to sort of do the other things that you can do. So, like the last story about tuition, paying for medicines, paying for rent, paying for insurance. All these things cost money. And so what we see is that for parents in particular, they are skipping meals so that their kids can eat. And even when they do, still some families don't have enough to eat. The other
Yeah,
thing that we ask parents about is what about free meals in schools? And almost 90% of Georgia families, parents support free meals in schools. And that is a place where we can really intervene to help have healthy, nutritious kids who can focus in class because they aren't hungry.
yeah, that makes so much sense to me. What could the long and term impact of this be if kids are going without food? Families don't have the food they need to get by.
Well, first we have the immediate effects of not being able to pay attention or being hungry in class. There's some evidence to show that there's mental health uh, issues related to food insecurity. And then as we see that play out long term, the worry is you've not just missed opportunities to learn, but there may be some long lasting even health impacts in some research. So, you know, I think part of this is if we focus in on kids early, if we really put resources towards Georgia's children's, it'll pay dividends for us in healthy adults. And so that investment really needs to begin, again, not just by our state legislature, but all of us can contribute something, whether it's supporting our local food bank or if we're in houses of worship, supporting local schools. School lunch debt is another thing that we measured. About 6% of parents reported some level of lunch debt. We know that meals cost between $2.50 and $3.50, 40 cents if you have reduced lunch. But about 50% of people with lunch debt had $25 or more of student lunch debt, and at the 75th percentile, that kind of top 25%, they had $100 in lunch debt. So, we're in this place where we have enough. Just like the last bit on from Kroger, if there's enough resources and food out there, I think this issue just flies under the radar for so many. And so I think this is really one of those issues where collectively, whether it's legislative action or action in our communities, we really can do something about it.
Just lastly, you mentioned lawmakers there. What do you want people who are in a position to make policy to take away from this data?
Part of it is universal free meals. We know it works. During COVID and the immediate aftermath, meals were free in school. And that really came from federal funding. USDA created waivers for meals to be free in schools and for there to be summer lunch programs. Well, those went away. So the state can act, certainly, like other states have, to make meals free in schools. And Congress can act, too, to create that ability and the funding for states to be able to make meals free within our public schools.
Thank you so much for your time. We really appreciate it. This is such important information, and everybody needs to know what our neighbors are going through. Steve and Patrick, thank you so much for your time.
Have a good day.